Aloha. I'm Senator Russell Ruderman from the Puna and Ka'u District on the Big Island, and I'm your host here at Ruderman Roundtable. Today we have as our guest Dr. Susan Jarvi, who is professor and chair of the Department of Pharmacy at the University of Hawaii at Hilo, Daniel K. Inouye College of Pharmacy. She's also the director of the Infectious Disease Laboratory there at the college in Hilo. Welcome, Dr. Jarvi. Thank you for being with us.
Thank you very much.
Good.
It's nice to be here.
Thank you. I know that for the last 5 years you've been doing a lot of work on the Rat Lungworm Disease, which, from my understanding, is not as well known as it ought to be, and that's why we're here talking about it today. What is Rat Lungworm Disease, and how do most people get infected?
Well, rat lungworm disease is caused by a worm. It's a nematode called Angiostrongylus cantonensis. I know that's a mouthful. But this worm is not unique to Hawaii. In fact, it's a global rat lungworm disease is considered a global emerging disease. At least 30 countries have reported cases of rat lungworm disease, and Hawaii, unfortunately, is considered as the epicenter for this disease in the United States. So how do people get infected? Well, you have to know a little bit about the life cycle. It's called rat lungworm disease because the parasite, the worm, reproduces in the rat itself. And the rat produces eggs. The eggs are eventually develop into first stage larvae, which are then excreted in the feces of the rat. And that first stage larva, it's not infective to humans or rats themselves. It has to go through an intermediate stage, and that stage is the rat lungworm first stage larva develops into third stage larva in the slug or the snail, and that's the intermediate host. And that third stage larva is what is infective to both the rat, so that's the life cycle, but that third stage larva is also infective to humans and other animals like dogs and horses. And so how people get infected, many people don't really know, but one of the main ways is through ingestion, either through food that's been contaminated by a slug or a snail that's infected, or by possibly by water.
So why don't we call it slugworm disease?
We can if you'd like to.
So humans get infected by the residues on our produce, perhaps, or in our water from snails and slugs. Is that correct?
Right, from the third stage larva.
I see. What are some of the symptoms of rat lungworm disease?
Well, the symptoms vary. So what generally happens in humans is that the larvae penetrate through the intestines, travel through the bloodstream to the central nervous system in the brain. And so if they make it to the brain, then you have all sorts of neurological symptoms. When the larvae travel across the intestines, it can cause inflammation. So sometimes you have GI issues, sometimes vomiting. A lot of the more serious symptoms come from the larvae being in the brain. And they're in the brain till the larvae die, essentially, and so they can cause a lot of neurological damage. So balance problems, eyesight problems, extreme headache, tingling of the skin are other symptoms, paralysis. If the infection is severe enough, patients can go into a coma, and we've had some deaths.
What are the treatments for rat lungworm disease?
Well, one of the main things you want to do is minimize inflammation. And so if you're diagnosed with rat lungworm disease, which is hard to do, a good diagnosis, the physicians will recommend anti-inflammatories like steroids or prednisone. And that's pretty much universal, a standard treatment. You can also try anti-parasitic drugs like mebendazole or albendazole. The problem with those, in some circumstances, it's been reported that it can actually cause an increase in inflammation. So I think it's up to the individual attending physician and the condition of the patient whether they administer albendazole or mebendazole, anti-parasitic drugs. You can also do other therapies, not treating the disease itself, but treating the symptoms. You can help patients with supportive therapy, IV vitamin therapy, physical therapy, acupuncture. All of those have been reported to be helpful.
Why has rat lungworm disease recently become such a problem with increases in the number of serious cases, especially on Hawaii Island?
Well, I think there are two circumstances. You know, it's been known to affect people in Hawaii since the 1960s. And then two circumstances. One is that we've had an introduction of a particular type of slug. There have been slugs and snails here for decades and forever. But in 2004, we had the introduction of the semi-slug. And the semi-slug you can recognize because it has a little residual shell. It's kind of in between a slug and a snail, about the size of your baby finger nail. And this semi-slug appears to be a very effective intermediate host. And the semi-slug was introduced probably with plants coming into Puna district. And now it's spreading. I live on the Hamakua coast, and I had never seen a semi-slug up there until last year. But there's nobody really tracking the expansion of these populations, and it's a very effective intermediate host. Plus, it's very mobile. It likes to move. The second circumstance I'd like to mention is the fact that a lot of people, especially on East Hawaii, are on catchment. And it's so critical to be able to have a clean water supply. And you do have to have all of the correct filtration and hopefully whole house UV systems in place to try to minimize exposure. And a lot of people don't. So I think that's an issue of concern. And there's no reason why you can't think that people can get infected through infected water. In fact, this has been shown in rat studies that rats could get infected by drinking rat lungworm contaminated water. So why wouldn't humans?
So people are at risk not just from the slugs and snails, but also from catchment water that may be infected and unless it's very properly treated.
Right.
It's rather expensive to properly treat. So that may be a difficulty for renters and people who have challenges. So it started, we first saw it in Puna and in East Hawaii, but now we're seeing the semi-slugs and this disease on other parts of the island and on other islands?
Right, yeah. And so for one thing, you have to assume any mollusk species, not just the semi-slug. Any snail or slug species can potentially be a carrier. You just have to assume that. We've had serious cases in Kona and Maui recently. There's been cases on Oahu. It's been documented. Rob Cowie's lab at UH Manoa has clearly shown that the parasite's present on all the main islands. And so, why most of the cases are coming out of East Hawaii could be a number of issues, but primarily we're thinking maybe this semi-slug combined with catchment.
Do we know the number of cases that there have been of rat lungworm disease?
We don't really. So we can go by what the Department of Health reports, which is about 60 since 2001. But I think most people think that's a real underestimate because this disease is so hard to diagnose, and probably many cases go unreported.
Okay. What percentage of people living in Hawaii have had rat lungworm disease?
I wish we knew.
We don't know, huh?
Yeah, so there aren't any firm numbers that I am aware of. Again, you can go back to the Department of the Health numbers of those confirmed cases, knowing that it's probably an underestimate. Right now we're conducting a study in East Hawaii to be able to estimate, it's a pilot study, to be able to estimate the prevalence of exposure to rat lungworm parasites. And so this past year we've collected over 400 samples from human volunteers, participants in the study, and we're looking for antibodies against the parasite in their blood. And so if you have antibodies that demonstrates to you that you have been exposed or you're currently exposed to the parasite. And so that study is ongoing at this point.
So it seems like much more research is needed, is that right, to understand the extent of the problem, as well as the treatments and prevention. If a person thinks that he or she has been exposed, what should he or she do?
Well, they should see their healthcare provider. Go to their doctor.
And do you think doctors generally speaking in Hawaii, know about this disease enough to accurately diagnose it when they first are presented with it?
Many of them know.
Okay.
You know, and I think it's even harder on the mainland when tourists come and then they travel back to their city of origin. And we do get calls from physicians from all over the country trying to figure out what they should be doing for these patients. So the physicians here, I think there are, especially in East Hawaii, physicians that are very well aware of this disease and are doing their best for treatment. Again, the treatments are, you know, it's really a difficult to diagnose type of disease, as well as the treatments, which are primarily to reduce inflammation.
So it's very difficult to treat, but we can't prevent it with education and preventive measures.
We can. Yeah. We certainly can. It is a preventable disease if you know about it, but most people don't know about it.
So spreading awareness and education of how to prevent it would be one of the most crucial things we can do, I assume. Huh?
I think that would be a really important place to start.
If someone has the disease and survives, is he or she then immune from further infection, or they can be reinfected?
No, nematode infections are notoriously difficult to develop vaccines against, for example, because you don't have the production of long-term immunity like you would with you know, some bacterial infections or viral infections. And we've had several people that have had rat lungworm more than once.
Oh, really? Oh, that's terrible. What is the severity to humans from rat lungworm disease? How serious illness is it?
It can range from, again, flu-like symptoms, fever, so that you wouldn't even think it would be rat lungworm disease. There's symptoms of other kinds of infections, to very serious coma and death.
So there have been cases of death. And I know there's some folks who've had it that are still not fully recovered.
Long
5-7 years after
so
getting the disease.
think of it's a very disabling in the serious cases where you have a lot of neurological damage. Some people so far have never recovered.
It's terrible. What are the best ways to reduce risks to getting rat lungworm disease?
I go back to prevention.
Okay.
You know, and so a large part of our program is trying to educate the public. Educate healthcare workers about this disease so that they can take measures to try to prevent it. And we're working with a number of schools. We've developed a curriculum for second grade classrooms where the students can work through an activity book, and we have online resources for teachers. Like one of the students, Kehao, and working with is working with 5 schools with school garden projects at this point in time, developing integrated pest management plans, which ones work best for which areas, which is phenomenal work. Kay is, as you know, is a graduate student in the TCVES program, and her son Graham was seriously infected in 2008 and still trying to recover. So
the precautions include washing vegetables very, very carefully.
Very, very carefully. I mean, when I get lettuce, I take each leaf.
Every leaf.
And wash it under potable water. And look, if there's signs of any damage, I usually, it gets discarded. Take in your pet's dishes, your dog food and your cat food that might be outside at night. These draw both rats and slugs. It's giving them a free meal.
And cats and dogs can get this disease,
well,
right?
dogs for sure.
Dogs for sure.
Yeah, there have been several dogs that have died due to this disease, as well as horses on the Big Island.
Now tell me, if you are cooking your produce, do we have to worry about rat lungworm disease, or is it only for raw ingestion?
It's raw. So
only
if you
raw.
cook it, or if you freeze it.
Freeze it. Freeze it also kills the...
Yeah, so if you want to make a kale smoothie, put the kale in the freezer.
Freeze it for a day or two.
At least a day.
At least a day.
At least a day. Yeah.
So we don't want people to be afraid of eating local produce. We just want them to understand what precautions need to be taken.
We live in a tropical environment.
Yeah.
You know, and this is a tropical disease.
So we need to learn to live with it.
We need to learn to live with it or change our eating habits.
Okay.
Yeah.
What are some of the questions that the Hawaii Island Rat Lungworm Working Group wants to investigate and find answers for?
Well, again, going back to prevention, we are working on a number of studies and trying to get funding to continue these studies so that we can determine where on the island the highest levels of transmission are, where are the most heavily infected slugs and snails, and what species are they and where are they moving. And so if we can determine that, then other agencies can go in for control and implement control measures for slugs and snails and rats, particularly in those areas. We are also working on trying to figure out what solutions might be effective in washing your vegetables. People ask us all the time, what can we wash our vegetables with? And I have to say, I really don't know, because we haven't completed the studies. We do know vinegar appears to be ineffective, as well as hydrogen peroxide. So I'm pretty safe saying those will not, as far as we can tell, affect the larva. We're concerned about catchment, especially with all the catchment use here on Hawaii Island, so would like to do some studies to determine what is the most effective way of treating your catchment water. Make sure that the filters that are being used can actually block the parasite from getting into the household water supply, and educate people about proper maintenance of catchment systems. We're working on diagnostics. Would like to develop an earlier diagnostic, and in doing this, we've done a preliminary study to see if we could detect parasite DNA in the blood of rats, and we've showed that we could. So now I'll be trying that as well in our human samples that we have. We ran a vaccine trial to see if a vaccine developed in Spain would be effective against the parasite here, and unfortunately, based on our studies under those conditions, the vaccine was not effective. And so right now we're working on this prevalence trial so we can get an estimate on how many people, at least in this pilot study, how many people have been exposed to the parasite. And again, education is really key in prevention, and so we have a large component of our efforts are on education.
So you're currently testing people, whether they've had symptoms or not, to try to determine what the prevalence is, and perhaps of undiagnosed or very mild cases that weren't diagnosed.
Right. So along with our testing, which is for antibodies against the parasite, we asked everybody to fill out a survey. And so when we have all the results, which we're still midstream, we'll be able to correlate the level of infection or exposure with their responses in this self-reported questionnaire.
What can the public do to help?
Well, the public, we have some websites which you'll see on the screen. The public can first and foremost contact their legislators.
Okay.
And
what should they tell their legislators, by the way?
What's that?
What should they tell their legislators?
Their concerns.
Yes. And
their lack of action and education and information. Right now there's practically no information out there. Tourists don't hear about this. They're visiting a tropical state. You know, there should be some information not just about rat lungworm, but about all the other diseases that are potentially hazards here in the islands. That would be very helpful. And information in general, become more educated about the disease. And again, there's websites available, not just at the CDC and the Department of Health, but we have our website up on the screen. Educate yourself about rat lungworm disease. If you know about it and you know how to best prevent infection, I think that's our best bet.
And what would you like legislators to do about this?
I would like to see more cooperation between agencies. So Department of Health, Department of Ag, Department of Education, EPA. You know, one of the issues is catchment, and there's nobody overseeing catchment use, or when somebody buys a house, there's nobody there to check out the catchment system, make sure. And again, renters, when renters are and if the landlord's not taking care of the catchment, how can they deal with that? You know, so I think legislatures could encourage more cooperation between the state and federal agencies and research institutions like ours. And again, it's really important that people become educated about the disease.
What has been the cost to taxpayers of this disease? Do you have any estimation of its cost?
Huge. It's huge. You know, when Kay's son Graham got so sick, we jotted down just off the top of Kay's head about how much that she was aware, and it was close to $1 million, and I'm sure that was an underestimate.
For just that one
For just
case.
one severe case.
And I imagine some of that cost falls onto the public through public hospitals and emergency room visits. And, how did you get involved in studying rat lungworm disease?
Yeah, I mean, I had heard about it years ago, but I didn't really give it too much thought because what the state and federal agencies were saying was a flu-like, self-resolving disease. And so it wasn't until I was invited to participate in what was the second annual International Rat Lungworm Workshop being held in Honolulu. And I went over there, and that's when I met Kay and Graham. And I realized that, wow, I had never heard that it was so severe, that it could become so serious that he almost died on several occasions. And he's still going to have disabilities probably for the rest of his life. And so at that point in time, Kay and I formed the Rat Lungworm Working Group. And since then, in the short 5 years or so that we've been in existence, I feel we've conducted a lot of studies and made a lot of progress on very minimal funding. We're probably one of the most, if not the most, active lab in the country on rat lungworm research and education. And I must say, I've written and submitted 11 or 12 grants that of those we've only been able to get funded about $150,000.
So mostly you've been funded only from grants so far.
Right, for extramural funding. And so, for example, for the publication of the rat lungworm activity book, that was due to a congressionally directed grant that came into the College of Pharmacy from the Department of Education. And so a part of that, about $20,000, was used to publish the activity book. And we had 10,000 copies produced, and we've distributed them. We don't have very many left at all, maybe 50.
You know, I saw that book. It's a coloring book for second graders, basically, right? And it's very educational, but it also allows teachers to include science and math and information as they learn about that, right? All STEM subjects. And you have curriculum support for teachers for that, right?
Yeah, we have online resources.
I believe I heard you say that kids enjoy learning about this more, so or show more interest, perhaps, than adults do.
Yeah, well, it is a pretty awful disease, and so even to talk about it to the average adult, they start cringing.
Yeah, I'm one of those adults who likes to talk about rats too much.
But if you're working with kids, they're like, rat poop,
They like
really?
that stuff,
And they're very interested, and the book that we produced makes it fun. It's not a light topic, but as long as it's approached in a way that doesn't scare the children, that they learn, oh yeah, no, we can live with this. We can do, you know, we just don't touch the slugs, you know, to make a slug jug, try to control.
So you teach them how to do the research on slugs and how to help eliminate them while taking all kinds of precautions to keep them safe, make sure they don't, as you mentioned, it can theoretically be contracted through skin contact,
Yeah,
perhaps.
there haven't been any studies in humans.
We don't
Who
know,
wants to volunteer for that, right?
So
but in mice, they've been able to show this. Yeah.
I see. So out of precaution, we don't handle the slugs with our fingers, and don't let the kids
use
do
gloves
that either.
or use, you know, disposable chopsticks. Work nicely.
Oh, I see. What would you be able to do with more funding than you have now?
Well, you know, again, back to prevention. And so one of the issues is the whole farm to school bill. My nightmare is kids getting sick. And so in order to educate everyone from the whole spectrum, from the farm all the way to the workers in the cafeterias, takes a lot of personnel. And so, and educated personnel to provide guidance for safe food production all the way through. You know, educating the farmers. Are the farmers using untreated catchment water to wash their produce? I don't know. I assume some of them are.
I assume so.
You know, so it's an education endeavor that will require fairly large numbers of personnel that are educated. And again, then going to the farmers that are producing and selling commercially, do they have rat control? Do they have, are they managing for slugs and snails? Do they understand the importance of this?
So the farmers need to not only wash the produce before they deliver it to a restaurant or a market, but they also need to do vector control, or controlling the slugs and the rats on the farm to minimize.
And there has to be people that are trained and educated in this to help educate everyone, not just the farmers, but all the way up through the stores, you know.
Have you found that people have been receptive to their educational efforts when they learn about this?
I have.
Good.
We have done a lot of presentations, and people are very appreciative of knowing about this.
So rat lungworm disease is a very serious disease that, contrary to what some people assume, it's not limited only to East Hawaii, although that's perhaps where it got started in Hawaii, and is entirely preventable with education and careful efforts to control it. I thank you so much for being with me today, Dr. Jarvi. I'm a big fan of the work that you do there in Hilo, and I represent one of the districts that has a lot of this potential problem, so I'm very excited about the work you're doing, and I hope we can get you further funding, and I encourage your research so much. Thank you for being with me today.
Thank you, Senator. I appreciate the opportunity.
Thank you.